topic is on groin swellings, which are very common conditions that we see in our patients. This is a short clinical history of a patient who presented with a left groin mass. This is a 40-year-old man who presents with a history of pain in the left groin for 12 hours duration. The pain developed when he was lifting a bag of fertilizer while working on the farm, and he recalls having a slight swelling that used to appear on and off in the past. He has no past significant medical or surgical history. Examination reveals an obese, fit-looking man. Cardiovascular and abdominal examinations are unremarkable. Examination of the right inguinal region is normal. On the left inguinal region, there is a 3 by 2 centimeters non-erythematous swelling at the medial part of the left groin crease in the region of the pubic tubercle. Careful examination reveals that the neck of the lump is just above the inguinal ligament, but the anatomy is difficult due to groin fat. The lump is not reducible, and gentle attempts at reduction is met with discomfort and pain. The scrotal sac is normal and both testes feel normal. The laboratory investigations reveal normal hematological and biological parameters, and an abdominal X-ray is also normal. Taking into consideration the clinical picture of a 40-year-old man with a history of swelling in the groin suddenly becomes painful and irreducible, suggests the most clinical possible clinical diagnosis is an incarcerated left inguinal hernia. This slide shows you the exact location of what the groin is. This is the area. It's a groin. So the groin is the junction between the abdomen and the thigh. So the crease is the inguinal crease here. Okay, groin crease marks the center of the groin. So the important structures that are organized are the upper part of the thigh, lower part of the abdomen, especially the inguinal region, as well as the upper part of the scrotum or the vulva in females. Okay, what is a groin swelling? A groin swelling, a number of causes. The common causes will be inguinal hernia, either direct or indirect inguinal hernia, or it can also be a femoral hernia. It can be enlarged lymph node, lymphadenopathy, or lymphadenitis, or a cyst such as epidermal or sebaceous cyst. These are the three most common conditions in our patients. The less common conditions include vascular lesions such as saphenous varix, femoral artery and femoral artery aneurysms. Testicular swellings, especially related to the cord, undescended testes in children, and encysted hydrocele of the cord also in children. It can be painless or painful. Painful, the causes are usually due to strangulated hernia, infected cysts, lymphadenitis, torsion of the testes, epididymoorchitis, and referred or radiated pain to the inguinal region. Okay, these are the differential diagnoses for groin patient with groin swellings. Okay, the most common is your inguinal of hernia. The others include varicocele, hydrocele, epididymoorchitis, torsion of the testes, undescended testes, ectopic testes, testicular tumor, femoral artery aneurysm, lipoma, and lymphadenopathy. Okay, these are some pictures to show you, illustrate some groin swellings. This is a case of a groin swelling here. Okay, clinically this can be a irreducible hernia, inguinal hernia or femoral hernia, most likely inguinal because it's above the inguinal ligament, or it can even be a lymph node or a lipoma. Okay, here is a elongated lump. Okay, elongated lump from the inguinal region extending to the upper scrotum. Most probably it is an indirect inguinal hernia. Okay, these two lumps are bilateral inguinal hernias, can be direct or indirect. This is a swelling, large swelling in the inguinal groin, which can be an inguinal hernia or a cyst or even be a femoral hernia. Here, a case of infected lymphadenitis in the inguinal region, inguinal lymphadenitis. Okay, this is swollen and tender and red. This is another case of a lymphadenitis. In this case, it is not inflamed, so this is a lymph node, inguinal lymph node. Okay, another case of inguinal lymph node which is not inflamed. It can be lymphadenitis or can be due to malignancy, either primary or secondary deposits. This is a case of a saphenous varix. It's a dilatation of the long saphenous vein at its entrance into the femoral vein. In patients with varicose vein, you can see a bluish discoloration suggestive it is a venous congestion. This is an infected epidermal cyst with some discharging of pus from there. So this is an infected epidermal cyst. And this here is a femoral artery aneurysm in the groin, which is common among drug addicts who inject directly into the femoral artery. What are the diagnostic evaluations that you have to undertake in these patients? Most important is a very, very careful history taking and physical examination. I must highlight to you the importance of this clinical examination in the patient to come to a diagnosis. Next, if it is cystic, you can do a transillumination test. Okay, so which can differentiate between encysted hydrocele of the cord or some other form of cyst that is located in the inguinal region. Ultrasound of the scrotum is done to rule out the presence of fluid and also can determine the nature of the contents, whether it is bowel or something else. Ultrasound of the scrotum and the inguinal region is also a very important examination in patients where clinical examination is not very helpful. Blood tests are done to rule out some form of infection in these patients. Okay, this is a ultrasound which I told you of the inguinal region here and the scrotum. Okay, this is the testis, right testis here, and this is the inguinal canal which is occupied by the small intestine. Okay, intestine contents within the inguinal canal. So this is a inguinal hernia. This is a picture of an incisional hernia. This is a rectus sheath. There's a defect in the rectus sheath and invagination of contents from the abdomen, especially the intestine, into the subcutaneous space here. Okay, subrectus space, and this is your incisional hernia. This is a algorithm for the management of a patient with a groin hernia. Okay, there are a number of ways of classifying groin swellings, but I would prefer painful and painless. Some people classify as reducible and irreducible. Okay, but I prefer painless, painful and painless. The painful ones, again, you can divide into non-hernia and hernia. Remember, hernia is the inguinal hernia is the most common cause of groin swelling. Okay, so hernia most of the time needs surgery. After careful examination, you have to do surgery. It's the only definitive treatment. It can be either emergency or it can be elective surgery. Emergencies, when there are complications like irreducibility, incarceration, strangulation, then you have to do it as immediately, emergency operation. Whereas the elective operation is patients who have no complications of the hernia. How do you diagnose this hernia? Basically, clinically, cough impulse and reducibility. These are very reliable findings, but in patients with complications like strangulation, cough impulse and it may be negative and the lump may not be reducible. Yes, in this patient, it is not reducible. Okay, once you have diagnosed hernia, you classify them as emergency or elective. And then the various operations that can be done: hernia repair, hernioplasty, herniotomy, and operations on the bowel such as release of adhesions or resection in cases of strangulated or complicated hernias. The non-hernias, there are a number of them. The painful ones, usually referred pain, source abscess, lymphadenitis, and infected cysts. Okay, all these are painful swellings, and then you diagnose them and carry out the various types of treatment: IND, excision, biopsy, antibiotics, and analgesics. On the other hand, non-hernia cases, which are not urgent ones, will be lymphadenopathy, cyst, lipoma, saphenous varix, and aneurysm of the femoral artery. So this is a simple algorithm for the management of a patient with groin hernias. In summary, groin swellings are common surgical problems. Causes can be classified into painless and painful. Inguinal hernia, either direct and indirect, are the most common causes, followed by lymphadenopathy. Inguinal scrotal swelling must be carefully examined to differentiate inguinal and scrotal origins such as hydrocele, epididymoorchitis, and testicular tumors. These lesions that arise from the scrotum, you will be able to get above the swelling. Whereas if it is a hernia coming from the inguinal canal, then it will not be able to get above the swelling. Therefore, a very careful clinical examination is vital. Investigations often not needed except in conditions where diagnosis is not possible on clinical grounds. So you do an X-ray abdomen, ultrasound, groin and scrotum, and if necessary, a CT scan. Treatment depends on the cause. Hernia, you go for various types of hernial repair or hernioplasty. Non-hernias, you have to think of antibiotics, analgesics, and the definitive surgery for the respective case or diagnosis that you make. Okay, thank you very much for your patience and hope to see you again.